first session of healthcare, which is start with the fundamentals of healthcare, and then slowly we will go towards the advancement of the program, and that's how we will proceed. Now, talking about the fundamentals, let's understand what are the fundamentals of healthcare, and that's how we'll take it forward. So as part of this session, we are going with the introduction of healthcare, IT, then branching of healthcare, framework, and then healthcare statistics. What are the major developments which are happening in the industry? So these are some of the areas which we are able to understand the basics of the industry, so that when we move on to the advanced implication in terms of understanding those details. The other value is also to understand, to make you understand how to follow trend, how the industry is changing, so that after this training you know what exactly the starting point, what to look for, and you are able to follow that. Now, let's start with the first topic, which is introduction of healthcare. Now, when we talk about the first thing comes into the mind, what we are targeting. We are targeting the area, and we need to know as possible about where we can go as an analyst in the IT sector. Most of the jobs, what you see is more from the insurance company side. That's where most of the jobs are. So we are trying to cover as much as possible about those areas so that you have a right target about the job. Now, talking about that insurance industry, let's understand and talk about it. What is health insurance? In a nutshell, if you see, we have a health and we just need to take care of that. So you have a health, get the care of it. A health insurance policy is a contract between an insurer and an individual or group in which the insurer agrees to provide specified health insurance at an agreed upon price, which is called premium. Then higher level, if you need to understand the term health insurance, it is just on a very high level you need to understand. It's generally used to describe a form of insurance that pay for the medical expenses. That's what the health insurance is all about. On the other hand, you also say this is a protection against the medical costs. Or you can say that there are various ways to explain the things. Like we are talking about the premium here. What is the premium? Premium is a fixed amount where the person who is buying an insurance, buying that protection from the insurance company, agrees to make that payment. Now, the health insurance usually provides either direct payment or reimbursement for expenses associated with illness and injuries. Now, there are two keywords to pick up. Direct reimbursement, what it is. When we talk about direct payment, always understand we are talking about the provider, which is your physician who is providing the services, getting fee from the insurance company. Whereas you have the reimbursement. Reimbursement, how it works, reimbursement is moreover where members pay out of their pocket and then getting reimbursed from the insurance company. So most of the time if you have a supplemental coverage, which is kind of a dental or vision, you will see you are dealing more into the reimbursement manner. What it means, you pay out of your pocket and then you fill out the insurance form. Insurance company and then insurance company, depending upon full or partial whatever payment you are eligible for, will get you the reimbursement. The cost of the medical care and the treatment have soared to the new heights in recent years and are expected to rise even further in years to come. And the reason being we are having so many mandates and the legislative changes just to make sure we have a good grip over the cost of the care. But the question is, are we there yet? And the answer to that question is no, we are not there yet. So industry is changing, technology is changing, similarly the demand is also changing. So far we are not able to capture that, and that is the reason we are not able to get the control of the market to say that, okay, now we have the cost of the care in the moreover controlled way. We can control the quality of the care, we can control the price of the care. So we don't have that. Now, what are the branches of healthcare? So as you see here, this is a pictorial representation of most of the areas what you can imagine. So healthcare is moreover divided into 4 or 5 subparts where you have health information, medical science, infrastructure management, customer support, and the finance management. There is nothing outside of this. Whether we are talking about pharmaceutical, whether we are talking about the life science, whether we are talking about the payer and the provider industry, they all belong under the one of the umbrella what we see over here. Now, as we see here, technology is the area which is more primarily these type of training programs are targeting into, because that is the one where we all are trying to get into. And that is the area where you are trying to move towards. So from the information technology side, you have EMR, ESR. We'll go over all of these sections in detail so that we understand in a detailed manner. Then we have electronic data interchange, facets, operational support team, comes under your medical science and the business SME. They also come under infrastructure also. The reason why I don't want to put it, see, your operational support team can be working anywhere. Your operational support could be part of this networking team also, because making sure that the operation, the day-to-day work is being supported. Then you can have a subject matter expert from the infrastructure also. But the question is, are these people going to be supporting these efforts? And the answer is no. That is the reason this is kept outside of the information technology. Now let's look into each of them. So let's start with the customer support. So this is one of the areas under healthcare. This is one of the branches of healthcare. So what do we see here? Customer in any other business have the highest priority. And that is very obvious, because that is the driving factor for any business to grow and do better in the market. If they don't like the services, so let's try to understand, I'll give you an example. If doesn't like the cafe at the services at the cafe, then what will happen? They won't return back. So let's take an example of a Starbucks. If you don't like a Starbucks, you will never go. The first time you tried it, maybe you didn't like their service, how you was treated. That could be anything. Next time you will not go. Now the possibility is you may not go to the same Starbucks, but you may go to the other and you are well treated over there. So what happened? Bad customer feedback, direct impact on the customer satisfaction. Now if they have a depraved experience ordering online from one business, then they will simply use the different business next time. So this is the recurring process, and that's how it works. Now let's talk about many in the healthcare industry are already recognizing the financial benefit of focusing on an excellent patient experience. Now the patient experience is very much important for any healthcare practice to grow. What happens when you buy an insurance, whether you're taking the health insurance or the auto insurance, you look for the feedback, you look for the review, who have the competitive price, competitive services, and review about claim processing, like they don't make much fuss about it, they are genuine in terms of paying the claim, there is no harassment. So then what do? You move on with them. So the hospital industry hasn't had much pressure before, but lately things are shifting, especially as we prepare for a new world of healthcare services defined by Affordable Care Act. So what is happening? This ACA, which is right now very much everywhere, which we will, ACA is explained in a very detailed manner in one of the chapters, you'll understand it. What ACA is all about, they have put lot of parameters for the hospital which is impacting them and pressurizing them to make sure they have a better tab on the quality of the care and quality of the customer, quality of the services what they are providing to the customer, so that the customer satisfaction is there. Now, many in the healthcare industry are already recognizing the financial benefit. By doing that, what is happening? By understanding the financial benefit, they are able to put the better plan on the table, better offering on the table to say, okay, if I propose this solution in the market and if I market my hospital or my practice in this way, these are the future outcomes, these are the returns I may get if I have a better customer support and a better customer satisfaction. So these, many of the hospitals and the healthcare practices, once you take the services, either they have a call with the customer, kind of a phone call, or they send out an email asking for the feedback. So these things are commonly growing in the industry and getting very popular. Now, talking about the customer service, what do we see here? This is kind of a decision tree. You have a dissatisfied customer. How it happens? The customer filed a complaint to the service rep. Service rep can go in two routes. Either the problem is resolved or it's unresolved. If the problem is resolved, customer is very happy. If it is not, customer is very dissatisfied. Now, if you see here, satisfied customer don't complain, then stays dissatisfied. So this ends over there. But if he does complain, there are two possibilities you may have. Now for the dissatisfied customer, if the problem is not resolved again, if he will just give it up, leave it, then again he is still dissatisfied. Whereas if he escalates the issue, it will end up into some level of agreement or some level of, I would say, agreement or the satisfaction which can be managed for the future, which can be beneficial for the future. Think about a small example I'll give you for the copay. What happens? The patient visited the physician office, the copayment was paid upfront. Now the claim was submitted by the provider, by the physician to the insurance company. Now the insurance company has made the payment. In the insurance company, the statement which is sent to the provider and the member, it says $20 is the co-payment which member is responsible for. Now, when that statement reaches the member knows that, okay, that member have made the payment. So member is least bothered about it. But on the other hand side, because of system hiccup or XYZ, any reason, the billing office keeps sending the statement for the $20 as a balance due. Now that person, what he should do? This is how he should go. He should just provide the proof that, okay, this is the bank statement. When I was there, this is the date of service. I made the payment for the co-payment. And then that's it. But let's say the payment was paid cash. Member doesn't have any receipt of it. The physician office is saying, no, we don't have any record of it. Then what happens? End of the day, member may make the payment, but there is a discount. So this is just to give you one example to understand how that can work. Now, let's talk about the financial management. Now, the primary role of financial management is to plan for, acquire, and utilize funds to maximize the efficiency and value of the enterprise. See, fund is a very important thing, whether we are talking about the private organizations or whether we are talking about the public. The reason being is all these mandates, legislations which we keep hearing here and there, they all play a very big role when it comes down to put together finance in place and making sure that how do we run the projects in the IT industry? We run the project using the funds available and in a higher level. So if there is no fund, the project may get terminated in the middle of the project because there is no fund. So this is exactly how any organization manages the fund. So similarly to, in a layman term, in your house, what happens? If you have a poor finance, you will have a lot of struggle. If you have a proper plan for the finance management, you know that kids' fee have to go, you know you have some like the house, car, insurance, all these things, you have sufficient funds which you have planned for. That is what your financial management is. So for industry, this is important. In the most developed countries, healthcare is paid for largely by government or an organization associated with it, using taxes collected from citizens. In United States, a portion of the healthcare system is market-based, that is paid by the private entities such as employers and individuals. So why it is private? Because here we have a concept of employer-based insurance, which is not that organizations. Now let's talk about the medical science. When we talk about the medical science, there are many things comes into that. So it is a science with the maintenance of health and prevention and treatment of disease. So that considers lot of things. So you have the pharmaceutical, that also comes under that, pathology, radiology, surgery, all these, wherever we are talking about the life science or whether we are talking about the medicine, all these things are part of your medical science. So that's why it lists out some of the branchings. What we see here, medical science have different branchings, and some of the examples are as follows. Some of the examples. See, not necessarily you need to know all these things, but the reason it is important is to give you the alphabets of healthcare. This is what it is. And once you start understanding the alphabets of the healthcare, you don't need me, you don't need anyone to help you understand what to Google and find out what you are looking for. Now, moving on. Now we are talking about the IT. When we are talking about the information technology, it's a Robert Selzer, a company specializing in managing access and identity in healthcare system. It's trying to give you a little bit of background of the healthcare industry. Think about a phase, think about the system, that all the transactions what you see today electronic are handled manually. If that is that has happened in the past, now slowly we have moved to the electronic. So when that has been done, what was the threat? What was the risk? The risk was that your data is exposed publicly. So Roger has given a very good example, and he describes filling out the same information on Murad's form does not endanger confidence. Being asked the same on an unattended personal computer in the hallway, then who can see that data? Worse yet, who can enter data about me? So what he is trying to explain is, think about the situation where the system, where your information is available, all your personal health record as well as your personal demographic is available in the area which is access to the general public. That's what he mentioned. He uses the term, the Mr. Jones data on the unattended personal computer, which is a very high risk because anyone can see what information is there about which person, and given the point of time, if they get access, they will definitely be manipulative about the data. So that's where your IT comes into the picture. So the future career growth is expected as business analyst, quality assurance, project manager, subject matter expert, and system analyst or clinical analyst, considering the rising need of the healthcare IT. So when we say that, this is exactly where IT comes into the picture and try to manage all these type of risk and the threat by adding the system into place, by securing the system, by providing security parameters, by providing the quality parameters. So that's where your IT comes into the picture, which encompasses your BA, QA, subject matter experts, project managers, and so forth, so on. Now let's talk about the framework of healthcare. So what are the framework of healthcare? Any healthcare system is encompasses of payer, which is your Aetna, Cigna, BCBS, Blue Cross Blue Shield, that means. Member like you and me, the government agencies like Department of Banking and Insurance, Health, Center of Medicare and Medicaid. You have HHS, which is Human Health Services. Then you have the provider, which is your hospital, doctors, and everyone who is providing the services, lab. Then you have the sales and the marketing. So these are the focused areas which comes under the framework of healthcare. Now let's start understanding each and every one. When we talk about the member, who is a member? When we talk about a member is nothing but a person who is purchasing the health insurance, or I can use a term like enrolls with the insurance company. Remember, these keywords are the keywords which you will be using it. Now we are getting into that part of it. So these are the actual things which you need to understand from the business analyst or the quality assurance analyst side when you are writing the requirement. So who is a member? The patient will not be called a patient when you are writing a requirement. The patient will be called as a member. So who is the enrollee? Enrollee is the person who is enrolled under the benefit plan. What is the benefit plan? The benefit plan is the policy. Now, in other words, an individual or dependent who is enrolled in and covered by a managed healthcare plan, a member is also called an enrollee or beneficiary. So these are the keywords for you to remember. All subscribers are members, but not all members are subscribers. And why is that? It is because all the members, your member could be your dependent, and member could be the head of the household who is primarily responsible for making the payment for the insurance. But your subscriber is only one. It's like that. You subscribe to the newspaper or you subscribe to the magazine. What do? There is only one person whose name is on the subscription, but everyone is using it. Similarly, there is only a single person who is responsible for making the payment in the policy, but he have other dependents like spouse and the children who are added as part of it. So that's why it says all subscribers are members, but not all members are subscribers. That's a very important point for you to remember. Now let's talk it through about rules to be a dependent. So there are some rules which are listed over there, but this is not everything, but this is most of it. So eligible dependents are member, spouse, or unmarried children under the age of 26. These are pretty straightforward rules which you will be able to follow through very easily. Under the age of 26, who live with the member in a regular parent-child relationship. Now the most common question is, what if the child is not living with parent but still dependent and staying in the dorms, in the college? How does that work? In that case, if the child is under the age of 26 and still fully supported by the parent, if the member is divorced, children who do not live with the member are eligible. if member is legally required to support those children. Stepchildren, legally adopted children, and the children in a guardian-ward relationship are also eligible, provided they live with the member and are substantially dependent upon member for support and maintenance. Is not capable of self-support due to the XYZ medical condition. When he or she reaches the age of 26 due to physical disability, mental retardation, coverage may the major line of coverage provided by the insurance company. The insurance company may provide medical, dental, vision, then depending on to have. So always remember the insurance company, what they are selling out. What is their major line of product? They are selling off HMO, PPO, but end of the day, what exactly HMO is? What is PPO? What is EPO? These are different set of benefits. But end of the day, this is just a health benefit. That's what it is. There is vision products, dental plan, vision plan, what it is? Different type of benefit. So you have a dental, you have a medicine, which is the RX, then you have a vision, then you do have a travel too. So these are just the different line of health benefit. The general agreement between the insurance company and the member that details the benefit that can be provided to the plan holder, that is, the member is called a plan. What is a plan? See, there is a very thin line between a plan and a policy. You will understand this better. So take an example, you have a PPO plan. You never use a term like you have a PPO policy. You don't say that. You have a PPO plan. That's what you say. And then when you are looking at the exact benefits, then you say, okay, these are my benefits and this is what I have in my policy. So policy is much detailed version of your plan where exactly by looking at the policy you know what is covered, what is not covered. That's what it is. So thus we can plan is a general range, whereas these when customized as per the member's requirements and put down on the paper as a legal document forms a policy. That's what the difference is. But again, now comes down to you just need to on a high level understand this. Wherever I make sure that when I'm teaching, I focus on the area what you have to know and what is something which you just have to high level understand what the concept is. So wherever I say this, you have to know, make a note of those things. Now let's talk about the provider. Who are the providers? As we see, whether we are talking about individual physicians, hospitals, lab, radiology, anyone who is providing the services considered a provider. Now, what is provider contract? The provider contract is also abstract. That terms and conditions defined under the benefit. Similarly, the provider also have the concept of contract. When think about it, when you call up the physician office, what do they ask? They ask you, do you have an insurance? You say, yes. The moment you company, what plan the physician has contract with that insurance company or not. So let's say member have an HMO. they will check whether the physician you are going to see have the HMO contract in place or not. The possibility could be that physician has the HMO contract, but let's say there is another patient who have PPO. Physician have no PPO contract. In that case, what will happen? You would have heard the term something like a in-network and out-of-network. So the PPO member, if being seen by that physician, will be considered as out-of-network care. As for the HMO, since the physician also shares the HMO network, will be considered as in-network. Now let's understand the agreement. The provider enters into an agreement with the insurance company. Under this agreement, they provide medical care at reduced rates to the members. In return, they are offered monetary benefit by the insurance company. Monetary benefit is nothing but it's talking about that, okay, providers can form a group which contracts with the insurance company. So you would have heard of pediatric group, physician group. What they do is there are 4 physicians comes under the umbrella of, let's say, if I say Garden State physician. The Garden State physician is where you multiple physicians working under that and providing the services. So these type of groups are called as IPA, which is your individual practice association. Now, this is all about your provider contract. Now, there are different 3 types of provider conditions you can have while processing the claim. You have a provider that can be participating, which is the PAR provider, which means that the provider is contracted. If the provider is contracted, the differential reimbursement will not be applied. What it means? The HMO member seen by the HMO physician, if the physician submits the $100 claim and payment of $80, the physician is only responsible for getting the $80 payment. The physician, unless the insurance company say that that member responsibility is $20, cannot ask and balance bill that member for the $20. That is what your differential reimbursement logic is all about. And this is just a reverse of it. Reverse of it meaning, if the PPO member in the previous example which you took was seen by the HMO physician, in that case it was the non-PAR provider. In this case, let's say the physician submits the $100 claim, insurance will make some payment if the member has some out-of-network benefit. So let's say insurance pays $50. Now there is a difference of 50-50. Then what happens? Now physician may balance bill the member because member is out of network. So that is a differential reimbursement logic will be applied. So these are the 2 conditions. Now the third is just the opposite, reverse of number 2. It's a contradictory. But always you need to remember, it says, the number 3 says that physician may be exempt and member responsibility may not be applied. This happens only under some exceptional conditions. For example, I'll give you that. Let's say there is some lawsuit filed between the insurance company and physician, or between the member and the physician, or member and the insurance company. That is one example. So under that case, that law may say that till the time the issue is resolved, consider this member as an in-network and the provider as in-network and make the payment as an in-network. So in that case, what happens? This differential reimbursement logic is waived and the member is treated as in-network. See, if you did not understand that concept, that's fine. We'll understand it with examples. So think about it. We have something called let me take one example. The main thing which you need to understand is the non-participating thing, because that is what is more important to understand. This one is very clear that whatever is the difference, the insurance will not go. This one is think about it, that the physician bills for the $100. Since we are explaining this condition, we understand that the member have visited the non-participating provider. Now in this case, insurance pays only $50. So what is the difference total still outstanding? 50. So in the first condition, let's say in the same example, if this was this, the physician is not going to balance bill member for this $50 because the physician is in contract and cannot bill addition. But if it is the second case where the physician is non-participating, this is a very big no. In this case, whatever insurance will pay. But whatever is the difference between what was billed, this is your bill charges. Against what was paid, this is your paid amount. Your physician is going to balance bill for sure. Now, this is called a differential reimbursement logic. Let's move on. So this is exactly how it is. As you see here, if you visit the in-network physician, you pay less. If you visit the out-of-network physician, your out-of-pocket is higher because you are going to be balanced bill as compared to in-network. You are not going to be balanced bill because insurance pays most of the amount. Now let's talk about the sales and the marketing. Sales and the marketing is the driving factor for any business. As an insurance company also, it has its own marketing workforce and also a pool of agents which are called a broker. Brokers are nothing but who works on the commission. Now as part of this team, there are two key roles which you have as an actuary and the underwriter. Let's understand the actuary. Actuary is a business professional who deals with the financial impact of risk and uncertainty. An actuary is a business professional who analyzes the financial consequences of risk. So moreover, they are trying to understand what is the uncertainty, and based on the uncertainty, how bigger the risk would be. Actuaries use mathematics, statistics, and the financial theory to study uncertain future events, especially those of concern to insurance and pension programs. So moreover, their job is look at the statistical data, use the computational mathematical method to find out what exactly the risk would be before they come up with any pricing to say this will be the premium. So they are the ones who does that. Then the question is, what is the use of underwriter? We'll talk about that also. Now, the role of the actuary is to decide the rate for the various services offered by the company. These rates are based on a variety of factors and involve statistical and mathematical computation. There is another role which you have, which is your underwriter. So just see this. You have the underwriter, you have a client, and then client has the risk and the exposure. Now underwriter is the one who is going to look at the risk highlighted by your actuaries. So the insurance underwriters evaluate the risk and exposures of potential client. They decide how much coverage the client should receive, how much they should pay for it, which is your premium, or whether even to accept the risk and insure them or not. So if the risk is higher and the premium is coming out to be mind-blowing and they are not able to offer that, they may reject it. The user group called actuaries and underwriters play a key role in deciding the policy rate, thus in selling the product, even though they do not interact directly with the customer, but behind the scene they play a very big role. So that's why the sales and the marketing workforce have this underwriter and the actuaries who are very strong bodies, who are very strong responsible positions, and the company rely heavily on them because that is the factor who is the risk and how to overcome that risk. Now let's talk about the healthcare statistics. What and why? So what do we see here? When it approaches the healthcare, what is considered as statistics? We just need to think it through about what and why. Let's see. What do we mean by statistical data in healthcare? Think of any industry, okay? So in any industry, statistical data means numbers. It all comes down to numbers. And these are the numbers which help in grouping the facts together and categorizing them into the bucket for the better analysis. And that becomes your more structured data, becomes your statistical data. So what do we see on the screen? What is the example? And visit the data. For example, we have persons under the age of 65, children under the age of 18, adult age from 18 to 64. Think about it. In the news, we keep hearing about some kind of that, okay, this is this type of, it's an epidemic condition. Or there are so many people diagnosed with this condition. In that area, there are more people. The America is aging. How do we know all this? We know with the help of these statistical data, what is the population. Under that population, each of the population is categorized into multiple buckets. You may not necessarily find the similar nature, the same kind of a problem in the people who are below 18 as compared to the people who are above 18. So these are the statistical data in healthcare also, which plays a very big role. And when it comes down to the actuaries and the underwriter, always remember these are the things they are looking at the overall population. Now, when we talk about the major developments in healthcare, these are some of the developments in healthcare. Feel free to study about these things in more detail. As much information you can gather, that would be very beneficial for you. So don't hesitate to explore these options. Now, there are some of the major developments in healthcare. For example, NPI mandate. NPI mandate is nothing but National Provider Identifier. What is that? Have to have the National Provider Identifier. That was the NPI mandate. Then it came down to HIPAA 5010 mandate. It was by December 2012. Everyone dealing with the electronic data has to be ready with the HIPAA 5010 mandate. We'll talk about some of the things in other chapters, what it was, how it was. But 5010 was nothing but, you think about it, whether you go to, let me give you another example. Whether you go to the physician in California or whether you go to the physician in LA, whether you go to the physician in Florida, whether you go to the physician in any other state, all of the physicians are going to have same kind of form. The placement of the fields could be different, but the piece of information what they are asking you to fill out is more over same. And why is that? That is because the industry, the government, the state mandates the HIPAA mandate 50-10 on them to say, if you have to request the data, you have to request the data in this format. That's what 50-10 mandate is all about. We'll talk about the 50-10 mandate, so don't worry about that. Health Insurance Marketplace. Affordable Care Act. Affordable Care Act, we'll have the case study, I think, which we can study more about. Then we have Health Insurance Marketplace. What is Marketplace? Marketplace is kind of a shopping complex for you, for your one-stop shop for your insurance need. So you can just look at the Health Insurance Marketplace, which will give you the idea. The government launched a website where everyone can go and look for the insurance and find out what insurance they are looking for. That's what it comes down to, the exchange. Now moving on. This is what your NPI mandate is. So I have tried to provide as much information possible. NPI stands for National Provider Identifier. Effective May 17, 2008, the industry began to use your NPI in the standard electronic transaction. And these are the option 1, 2, 3, 4. Anyone have to have one of the option in place. Prior to that, something called legacy ID was in use. But now since the NPI came, they said that, okay, here are your 4 options. Option 1, where your legacy ID is required and NPI will be allowed and acceptable, and the legacy ID is considered to be required. Now you have a dual ID, which is allow all of the following scenario, which is your NPI only, legacy identifier only, NPI and legacy identifier both. See, these are some of the options given to the insurance companies to make sure, or not only the insurance company, anyone who is dealing with the data, who comes under the umbrella of NPI mandate, that you can have a system where one of the criteria your system must satisfy. The third one is NPI per mandate. NPI required per mandate under HIPAA regulation, legacy identifier not allowed. So if your system is capable of taking NPI, you are not setting up the system to accept legacy ID, then also you are good. The next one is NPI per mandate. Legacy ID also allowed. Now NPI required, but legacy ID also allowed. So what they are saying is that, okay, NPI is coming, I don't want, if they are sending the legacy ID, you cannot reject the case. Let the system accept the legacy ID as well as the NPI. So this is what the NPI mandate was overall. All payers either accept or mandate use the NPI provider identifier. Rejection of claim can affect timely payment of your claim. Please communicate with your health plan and pay attention to the information you receive from them. So this is kind of a notation which was provided to the entire industry, that this is in place, making sure that they are in compliance with the NPI mandate. If you send a transaction without an NPI to a payer who is following option 3 or 4, the transaction will be rejected. So they are saying, this is the part of the mandate. This says that if anyone have this 3 and 4, they are saying that if you don't follow the norms, this is what will happen. Same goes with your legacy ID also. So if you send the transaction with a legacy ID to a payer who is following option 3, the chances, there are a very higher chance of getting rejected. Then again, you have a tax ID, not considered a legacy ID. Tax ID is the federal IRS tax ID. When used to identify the provider as a taxpayer for reporting to the IRS, please be aware when this ID is required. So there are certain conditions based on the HIPAA when the tax ID is required. So these are the different things which happened back then about NPI. Now the HIPAA mandate. Our new federal mandate require health plan clearinghouses. What is clearinghouses? Clearinghouses are nothing, the third party application third-party administrators who are just working between the insurance company and the providers, making sure their transactions are happening. So it's kind of a middleman. Providers to use new standards when electronically sanctioned. Security Health Plan must adopt a new file format by January 1st, 2012 for claims, remittance, eligibility, and other files submitted electronically. So, by end of December 2011, your 5010 has to be in place to be in compliance with the HIPAA 5010 mandate. This is what it was. So as you see here, this is your December 2011 go live date for the 5010. So if you are not, after this also, if you are not there, then it's a red. Then you have the health insurance marketplace, which is also called HIX. So when you are looking at the job, always remember HIX also. They have there are a lot of projects right now which is there on the health insurance market, HIX benefit and something like that. By October 1st, 2013, every state will have an insurance exchange, which is there now, an organized marketplace where individuals and small business owners can select from among all the qualified private health plans available in their area. What they need to do? They need to create an account, apply for it, and then it's like a shopping. You are shopping about your insurance, and then you go on, and whatever plan you select and put down your enrollment, and now you are enrolled. Affordable Care Act. What do we see here? ACA is a long, complex piece of legislation that attempts to reform the healthcare system by providing more Americans with the affordable, quality health insurance, and by curbing the growth in the healthcare spending in the U.S. Reform include new benefit, rights and protection, rules for insurance companies, taxes, tax breaks, funding, spending, the creation of committees, education, new job creation, and much more. Now, these are some of the areas where your Affordable Care Act have a very big impact, which it's not a one-page or a two-page document. It's a big legislation. But at the same time, if you try to look into the Affordable Care Act, try to see into the pieces. If you want to read and explore more about Affordable Care Act, read in pieces. Go and just Google out that areas impacted by Affordable Care Act. You will not get the full legislation, definitely that's not possible, but you are going to get in pieces, like for example, what happens which is pre-existing condition, what was there in the Affordable Care Act. For the employers, what was there. Then for the full-time employees, what was there on the Affordable Care Act. So these are the areas how you can just easily break it down and find out what is there, which you can explore and read it to make sure you can say and you can have a very good conversation with somebody if they are talking about the Affordable Care Act. At the same time, you will be much more prepared for the healthcare interview perspective to talk about it and based on and explain your understanding about the Affordable Care Act. Now, we talked about the several mandates which has happened in the past. Right now we are talking about ICD-9 to ICD-10 conversion, which is going to be effective on October 1st, 2015, and that is the timeline when that is going to be effective. So again, from October 1st, 2015, if anyone is delayed from October 1st, that means they are not in compliance with the data. They are not in compliance with the industry, and they are not in compliance with the rules and the regulations which they should be being a part of the industry. So this completes our section 1, which is the fundamentals of healthcare, and that is the end of the